Welcome back to another rendition of the NFL Injury Report. I'm your host, Dr. John, and today we're going to be going into a nice deep dive surrounding J.K. Dobbins' foot injury, which is being classified as a Lisfranc injury, or if you like to have a little bit of an accent with it, I like to say Lisfranc. Doesn't change the severity of it though. He is going to be going on likely season-ending injury reserve, but we're going to be talking about that a little bit later. First, let's get to the rest of the league. Sticking with that running back trend, Travis Etienne popped up on the injury report for the Jacksonville Jaguars. He is questionable with a shoulder injury. He took non-contact reps in practice again on Thursday after doing the same on Wednesday. So he will be classified as being limited again in practice. So it's something to keep an eye on moving forward. It should be closely monitored, especially with the fact that the backup running back, the rookie, I'm not sure how to pronounce his last name, Tutton? We'll go with Tutton. He is questionable with an ankle injury as well. So keep an eye on both of those Jacksonville running backs, especially Etienne. He's been kind of the workhorse for that offense currently. Lamar Jackson, he did not practice on Wednesday, and then he practiced on Thursday with that ankle injury. Seems to be following a similar-ish trend to last week where he also did not practice on Wednesday. I would expect him to play. It doesn't seem like there's been any setbacks. It seems like they're just monitoring and letting him have a little bit of extra rest. Warren, the running back for the Pittsburgh Steelers, he is questionable with an ankle injury. His status is uncertain for Sunday. So Kenneth Gainwell had a pretty good week for the Steelers this past week against the Cleveland Browns. So if Warren's not able to go, it's going to be the Kenneth Gainwell show again, but keep an eye on Warren. Drake London is doubtful this Sunday with a PCL sprain. He has not practiced at all this week up till Thursday, unless there's a pretty sudden drastic change for Friday and his activity at practice there. I would not expect him to play this week. Bucky Irving, we finally have positive Bucky Irving news. How about that? He was limited at practice again. He was limited last week. He's officially listed as questionable. Todd Bowles described him as ramping up his intensity this week. So it's unclear what exactly that means, but if he's able to get some contact in, maybe even a full practice here on Friday, that would be a really good sign as far as him playing this week. If not, I'd expect him back next week then. Dak Prescott was limited with a hip injury, but it was described as nothing too serious. It's likely the Cowboys are just being cautious with their franchise quarterback leading up to the Eagles game. If you can't tell, I don't know if I'm sold about Dak Prescott being a franchise quarterback, but that's a different conversation. That's a different show. Jackson Dart, he was out last week with a concussion that he suffered in the week before. He was limited Thursday in practice. However, he was the first quarterback to take reps at practice. He was working with the first team offense exclusively. So it's not a definitive answer, but it seems like a good sign, and it's likely indicating that the Giants are preparing as if he is going to be able to play this week. Jamar Chase, he's not injured as far as I know, but he is suspended, so he will not be playing this week after spinning a little bit too closely to Jalen Ramsey there, which he got promptly reminded that you shouldn't do in the NFL. But he'll be back the week after this one. Baker Mayfield and Emeka Egbuka have had a great connection so far this year. Seems the connection's going a little too far. They have both been on the injury report this week. They're questionable as of Wednesday with a illness. So maybe they shared a sandwich. I don't know. Too close in the locker room, but keep an eye on them if they're unable to go, if they continue to be limited through the week. Alrighty, let's get to the man of the hour, J.K. Dobbins. So he was placed on IR. His injury is suspected to be season-ending, with a very small likelihood that if the Broncos were to make the Super Bowl, there is a very small chance that he would then be able to be ready by that. If the Broncos can figure out that offense to pair with that defense, they'd have a much better shot. But his injury is officially being listed as a Lisfranc injury, which is an injury to the ligaments or the bones or the joints surrounding your midfoot and the tarsometatarsal joints, which are the tarsal bones, which is that midfoot area for you, leading into your metatarsals, which are the long kind of spindles, which on your hand, if you're looking, would be this part right here. Now, the reason why a Lisfranc injury is so important and why it's season-ending is because of the role that midfoot plays. And specifically for Dobbins, it's being listed as a ligament injury, which is he is having surgery to repair. There can be other involvement like a fracture of the bones that make up those joints, whether it's the tarsals or the metatarsals. But the way that it most often happens is when your foot is planted and someone falls on top of it. What that then does is it pushes that joint in those ligaments past the range of motion, and it results in some type of either sprain, rupture, or fracture. Now, Dobbins specifically was injured by a hip drop tackle, which is where the defender grabs the offensive player and then drops their hips down to try and just use their body weight to take them down. And ultimately, that is something that the league has been trying to ban, but it obviously still happens, and it's unfortunate that an injury like this occurred, but that's why they're trying to ban it. It's been leading to more and more pretty serious injuries. But getting back to the Lisfranc injury, specifically we're looking at the area of the midfoot and looking at the base of your second metatarsal. So if we're looking at the hand, not the big toe, but that second toe right here, that metatarsal, which would be down here at the bottom of your foot. The reason why this is so important is that it's kind of like the keystone of your midfoot. And what I mean by that is when you are walking, what happens is that your foot has to unlock to then absorb force. And so that midfoot then pronates to become a bag of bones, is kind of what we call it, where it then absorbs the shock as you bring that foot down off your heel and flat onto the ground. What it then has to do then is as you then move over top of that foot and then look to push off, your midfoot has to then supinate again and then lock so that you have a firm stabilizing like plant to then push off of. The Lisfranc ligament as well as the second metatarsal is the key to that. This is why it's a season-ending injury, because you lose that stable force or stable plant to then push off of. Before we look at the actual locking mechanism of that midfoot, we're going to talk about the ligaments that typically get injured in a Lisfranc injury. Now you have a dorsal or over the top of your foot and a plantar, which is on the bottom of your foot, Lisfranc ligament. The dorsal one runs from that medial cuneiform, which is one of your tarsal bones, and runs onto the second metatarsal again. Same thing for the plantar side, just on the other side of the foot, medial cuneiform to the second metatarsal. You then have ligaments running in between your cuneiforms, which are again your tarsal bones, and then the ligaments running from the metatarsals to the tarsals, which are known as your tarsal metatarsal ligaments. The one that is most often torn first and is the weakest is the dorsal Lisfranc ligament, the one over top of the foot running from the medial cuneiform to the second metatarsal. The strongest one and the most functionally important is the plantar one, the one on the bottom. If that plantar Lisfranc ligament is disrupted or injured or sprained or torn, especially, that's when you really start to see the instability. Depending on the severity, you can then have more involvement with the ligaments running between your tarsal bones, those inner cuneiform ligaments, and the tarsal metatarsal ligaments. Looking at the configuration of those ligaments in these bones and how it locks that midfoot in allows for you to push off of it. Like I said, the key is that second metatarsal. And the reason why is that that second metatarsal extends further proximally or like closer up into the midfoot than the base of your first and third metatarsals. It then forms this wedge between the medial and the intermediate cuneiform, two of those tarsal bones on in your midfoot there. It then allows that resistance to side-to-side motion. So that Lisfranc ligament, primarily the plantar one, but both the dorsal and the plantar are those primary stabilizers. Now, we talked a little bit about what happens when you're walking, for example, and what your foot should be doing if everything is intact, right? Like it pronates, you absorb the force, and then that midfoot locks, and then you're able to push off. Now, what happens if that Lisfranc ligament is disrupted is everything starts to shift a little bit more side to side and becomes unstable. So while that second ray, that second metatarsal, is that stability anchor, it's balancing the mobility of that first metatarsal and rigidity or stability of the third as well. The third metatarsal doesn't move as freely, but the first has to be able to move that big toe in order for you to still absorb force, but then push off of it to have proper mechanics as you're walking. When that Lisfranc ligament is injured, what ends up happening is that first metatarsal starts to drift in, and that second metatarsal starts to drift out. And what that then leads to is instability of the midfoot and that collapse of your arch, and then you can't actually push off efficiently. Now you're stuck in this like bag of bones loss of rigidity to push off of that foot and generate force as you drive yourself forward. And that's just with walking. It becomes even more severe and more obvious when you're trying to run or sprint or cut. And that's why this type of injury can be season ending, along with the fact that it more often than not requires surgery. Now, if it's just a sprain of that Lisfranc ligament, then surgery might be able to be avoided. You're likely still going to be in a boot, you may even be non-weight bearing, but more often than not, there's usually a rupture of that ligament or a fracture or some type of other injury to that joint. So usually surgery is required. They end up typically doing some type of internal fixation to either attach a new ligament, fix a fracture, fixate anything that might be displaced, whether fracture or otherwise, and then closing everything up and you're in a boot. Typically you're going to be non-weight bearing for up to 6 weeks. During that time, they're going to be doing exercises like ankle pumps, ankle circles, straight leg raises, things that you're able to do where you can still activate those muscles, try and prevent blood clots while increasing blood flow and not putting weight on that foot. From there, you're going to be starting to gradually increase weight bearing on that foot, spending some time in the boot and then out, and slowly increasing the amount of time that you spend out of the boot, working on restoring full ankle and foot range of motion and starting to build back strength. You might even begin resistance exercises, working on like plantar flexion, dorsiflexion, pointing your foot back and forth, or inversion, eversion, turning that foot in and out. From there, then you're going to start to increase the strength training, continue to work on that range of motion, and starting to work on balance. Because now, right, we talked about where if that ligament is ruptured and you're trying to push off, you lose the ability to push off of that foot as well as maintain your arch. So now you have to also work on your balance again. So they're going to be working on a lot of like single leg exercises, like single leg heel raises, and working to improve that strength and starting to get back to a more functional routine where they're able to do a lot of things that they would normally do throughout their day. From there, then you're going to be working on getting back to sport. So for Dobbins, this is going to be the key. Working to tolerate not only doing full days of his normal activities of daily living, but also working on tolerating practices and then ultimately doing plyometrics, side-to-side movements, more explosive sprinting, things that really require the ability to push through that foot off that big toe and making sure that that Lisfranc ligament and second metatarsal are doing their job to stabilize that foot and allow him to push off and drive forward. When you're looking at the full total recovery time, you're usually looking at somewhere of upwards of 6+ months. You're immobilized and non-weight bearing for 6 weeks. You're working on improving that strength and return to a really high level activity, which is playing in the NFL. Ultimately, it's such a key piece of your mechanics starting at your foot where you can't necessarily avoid it. And if it is lacking in any way, shape, or form, whether it's due to the stability, the strength, whatever it might be, the range of motion, then it is going to be very, very obvious and it will affect his ability to play on the field. So while they're saying like, yes, maybe he can get back in time in February if the Broncos were to make the Super Bowl, that is a really, really fast timeline. That might be possibly just due to the fact that his Lisfranc injury isn't as severe. Maybe it's just a sprain of the plantar ligament and maybe a rupture of the dorsal. So that plantar ligament, like we said earlier, is a little bit more important. Ultimately, I'm not aware of the details, but I wouldn't expect Dobbins to play again this year, unfortunately. And he's looking at easily a 6+ month recovery to try and get back to 100%. But that is a little bit of information, well, a lot of information, for being honest, about Lisfranc injury. Super, super interesting stuff. Really unfortunate that it happened to anyone, but especially a guy who was doing pretty well this year and had managed to avoid the injury bug for a little while, which had bothered him in previous years in his NFL career. But wishing him nothing but the best in a quick and speedy rehab. And honestly, I hope the Broncos make the Super Bowl and that he's able to prove me wrong and he's able to play. It's going to be a long road, but he'll get back. All right, that is everything for the NFL Injury Report this week. As always, thank you for watching, commenting, and sharing this video, and I'll see you guys in the next one.